esisibiza ukuthi umalalevever phecelezi malaria. Kanti namhlanje angihambi ngedwa, ngihamba nodokotela Makhosazana Dlamini ozobe echaza kabanzi ngesifo semalaria. Ngikwamukele Dr. Dlamini.
Ngiyabonga Dr. Prue.
Uma ungabe umchazele umbukeli osekhaya ukuthi ubani uDr. Makhosazana Dlamini.
Dr. Makhosazana Dlamini udokotela lo osebenzela eMpumalanga eIvenda. Ngokutalwa vele ngumuntu waseMpumalanga, dalelwe eManzana, currently known as Manzana, previously known as Baplas. Ngikhulele eMpumalanga, ngafunze eSifako Mahato, then used to be Medunsa. Currently ngisebenza as a general practitioner and a travel medicine provider based eIvenda next to Secunda.
Kanti abasamkhumbulayo sike saba naye la endlini sichaza yona indaba yama vaccination yabantu abavakashela kwamanye amazwe. Kepha namhlanje simbizile futhi uDr. Dlamini ukuthi azosichazela kabanzi ngaso isifo lesi sakamalalevever. Kepha ngaphambi kokuba siye lapho dokotela, kukhona izifo lesi sisibiza ukuthi ama non-vaccine kepha preventable diseases. La ungathi uma uvakashela kwamanye ama countries uzithole ngabe iziphi lezo zifo lezo?
Yes, dikhona tifo leti lesingakhona ukutivikela letingadzingi necessarily vaccine. Letiningi lento tichaza titholakala khona e-Sub-Saharan Africa which is parts yemhlaba lehlukumeta thina kakhulu. Letitayelekile ngaphandle kwalesi sitokhuluma ngayo lenkulu topic sitokhuluma nge-schistosomiasis, ibilharzia. Ibilharzia sifo lesijwayelekile South Africa futhi sikhona kakhulu. Bantwana labaningi basithola basakhula, umuntu masekamdala ahlishwe indzaba yokuchama umchamo lonengadi. Ikhona eSouth Africa, but we will not necessarily say ukuthi South Africa is endemic with schistosomiasis. Schistosomiasis or ibilharzia phecelezi ikhona kakhulu West Africa nase East Africa, ikhona Nigeria, Ghana. We also have it in our neighboring country Mozambique, ikhona futhi nase Kenya and Tanzania, and DRC. And then we also have the Hunter virus, which ikhona DRC nase Sierra Leone. Lama viruses lesikhuluma ngawo lekule lesikhuluma ngako manje ukugula lokhu affecta kakhulu in relation to travel. Ngiyathi ukuthi awareness in general nemuntu lo travel, but in relation to travel medicine siyathi highlight kakhulu. Kube khona ilona Crimean Congo hemorrhagic fever, lekhona DRC, ibe khona in certain parts of West Africa, ikhona futhi na certain parts of East Africa. And then kube khona futhi Zika virus. Zika virus of interest, there was an outbreak I think around 2010 around the Soccer World Cup. It was found in Brazil. And then bese kuba khona there's quite a lot. Lamaningi, I guess you can check them go CDC or check them go South African Society of Travel Medicine, which is a local source for all these related diseases.
Okay. Dokotela, namhlanje sikhuluma ngesifo sikamalalevever. Bangakanani abantu mhlambe ababa infected ngesifo sikamalalevever noma uthola ukuthi bashonile ngesifo sikamalalevever?
Yeah, malalevever or malaria commonly known, sifo lesi lokubuhlungu ukuthi sifo lesi umhlaba soyahluleka kusicontrol. Dzala sikhona, and I think lokunye ngema-pandemic lamanye lavelile and ukuthi awareness yemalaria abantu bangayithatheli etulu, kodwa sifo lesibaluleke kakhulu ngoba sibulala quite a lot of people. Statistics sithi kukhona i-statistics lesipublishe ukuthi between 1980 and 2020 bantu lababulawa ngemalalevever on average about 1.8 million. And that is a lot, considering ukuthi sifo lesikwati kusivikela nasingakhona ukusivikela njengoba sitodiscussa kabanzi namuhla. Lokunye futhi sifo lesingasheshe sisidiagnose kahle kahle sifo lesithutheka kalula lesingavikeleka, but unfortunately nasingakatholakali early or sisimisile then siya compromise singakwenda ukuthi umuntu agcina luza impilo yakhe. But on average bantu laba bulawa malaria every year there are more than 600 plus or minus 600,000. That is a lot.
Baningi laba bantu. Kanti kahle hle masikhuluma nge-malaria, isifo esinjani, singena kanjani futhi?
Malaria sifo lesibalulekile in terms of travel because sifo le research ithi malaria is the commonest cause of death among travelers kuma tropical and subtropical parts of the world. Sifo lesikhozwa i-parasite. I-parasite they belong to the family of Plasmodium. Plasmodium species maningi, kukhona i-Plasmodium malaria, Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and the Plasmodium falciparum becomes the one of interest because it's the one more dangerous, it's the one that leads to more death, it's the one that dominates kakhulu in sub-Saharan Africa.
Okay, so maseyikulumile lo mosquito, kungathatha isikhathi esingakanani ukuthi ukhombise impawu kanti iziphi lezo impawu futhi ungazibona ngokushesha?
Malaria umuntu ithola njani? Ithola ngokuthi alunywe i-mosquito le vector, i-carrier kahle kahle yale virus. I-mosquito i-carrier ye-parasite, I'm sorry saying it's a virus. I-mosquito isebenza ukuthi ithathe the eggs of the parasite from kahle parasite maqanza wakhona atholakala endaweni lemandi, hence vele mosquito atholakala lapho kumandi khona lapho kunemfula khona lapho belina. Then mosquito ithi nayithatha those eggs bese nayi-infecta umuntu ba infected, but it's part of i-cycle yale parasite ichubekela phakathi emtimbeni womuntu. And unfortunately, it's hence ibida uthi parasite. You know, in a parasitic relationship, you only sugi chubeka normally go cycle, but unfortunately, yenda compromise impilo yomuntu. So my symptoms, the onset of my symptoms are funny. Dependa. You've got umuntu lo sheshe are present quite soon. No umuntu after mosquito mlumile, they can present within a period of few days. Then no mundu can actually take a long time. Hence it's now dealing ngemuntu lo suspect ukuthi unemalaria. Kubalekile ukuthi umuntu ukuthi uke wahamba na. Because umuntu ngakhanza ukuthi ma signs we malaria, ma symptoms nge malaria ahlukile. Akhona la lesithi ma non-specific symptoms. La into ukuthi dokotela nakakubona angasuke angacabanga ukuthi malaria, especially nongeke uzumnikede i-history ukuthi wena bohambile. Umuntu angashisa, angaphathwa inhloko, angafuna kuhlanda, angachachatela abe nama-rigors and chills, and then lamayela angaba ne-diarrhea and vomiting. Lo munye umuntu angaba nama-specific symptoms ukhanze ukuthi uba ne-jaundice. Lo munye umuntu ke angaba bese uba nema-seizures, abe nema-fits, or you can even slip into a coma, and that's complicated into cerebral malaria. So my symptoms are ahlukile, but the commonest one usually kuba your fever, shisa nekuvamakhata. Abantu abaningi bayiconfuse ngazo ukuthi bangenwa yi-flu. Lawo ma symptoms uma ilunywe malaria nje basisho ukuthi it can last from few days to it depends. Nokuthi njenga for example, I think i-Plasmodium vivax ithatha isikhathi ukuthi ma symptoms are present.
Okay. Kukhona ukuthi mhlawumbe umuntu azazi ukuthi ubevakashile then uyabuya unalempawu lezi and then aye eclinic. Uliphi usizo kufanele aluthole eclinic ngokushesha ngaphambi kokuthi mhlawumbe asa complicate agciniseka esibhedlela. Uliphi usizo kufanele abonesi bampe wona, especially kuma clinic lapho ukuthi akude udokotela kude ama specialist.
Yes. For umuntu bekavakashile ngoba vele at the end of the day malaria is so common. And they are seeing access to a travel clinic for consultation. If bohambile uyenzaweni le mina believe ukuthi konke kuqala nge-responsibilities. Phila i-country where se highlight amalungelo more than my responsibility. Now kusuke South Africa malaria, uye enzaweni lene malaria like Mozambique, ngithatha ukuthi research you will have done, not necessarily research but lwati. Nebantu laba bazokuxwayisa ukuthi thatha tunesonke into kube nemalaria. So no ubuya uyathi ukuthi bowuvakashile. Once waqala uva ngathi ungenwa i-flu sheshe uye clinic kubalekile. Once kwavela ama symptoms kufanele usheshe uye clinic bachazele ukuthi uva ngathi ungenwa umkhuhlane ngoba impawu yakhona ngathi cishe impawu yomkhuhlane. and then ma-clinic lamanye ukhanza ukuba banayo i-rapid test. So akusukuthi ngoba labanye abantu don't have access to esibhedlela, labanye ma-clinic la remote, so it's advisable ukuthi babe nayo i-rapid test ye-malaria. So they can just quickly do i-rapid test ye-malaria and then bakuqala i-medication ye-malaria.
Okay. Manje ukuthi nawo-ke umuntu uvakashile wherever kuleyo country lapho kutholakala khona ukuthi malaria. Uyabuya uyahlala. Uyayizwa i-headache mara ulokhu uthatha kancane. Ingagcina yenzeni la emtimbeni? Imaphi ama-complications mhlawumbe angaba nawo?
There's a lot. My complications with malaria, I think the most serious one is cerebral malaria. Lokunye futhi you can have jaundice.
Uma sikhuluma nge-cerebral malaria, for umuntu osekhaya unga-understand lesilungu sabodokotela, ungachaza ukuthi uthi yini nje i-cerebral malaria?
I-cerebral malaria sithi ukugula kwe-malaria kusuke ku-affecta i-central nervous system yakho or i-parts yengcondo yakho. Usually siyibona ngokuthi umuntu abe nama-fits. Ngoba i-malaria ingayenda ukuthi umuntu abe nashukela lo phansi, or part of the treatment ingenda shukela ube phansi. So sithi if usesi-excludile ukuthi shukela bowungekho phansi, ufithile, ube nema-seizure, but ma-seizure sastopile mara soluku-coma awuvuki, there's a sign ukuthi sowune-cerebral malaria. And usually vele it has high mortality. Umuntu lo sowuphathwe i-cerebral malaria usually they don't make it. Okay. And so kubalulekile if ukuthi uzohamba uyenza le-malaria, earliest symptoms, the development of symptoms, you must just go and get help.
Ngoba kahle ungathola usizo ngisho eklinikhi,
ngisho naseclinic awudingi nokuthi uyesibhedlela.
Ngaphandle kwengcondo imaphi amanye ama-organs ala emzimbeni ayinga-affecta imalaria?
You can also have liver. You can have jaundice. Because why jaundice? Because part of his cycle, the parasite is also in the liver. So you can have jaundice. You can have anemia because part of the cycle, the parasite iguma red blood cells, so it destroys my red blood cells. So you can have anemia. You can have liver failure. You can have liver complications. You can have like hypoglycemia, sugar level. You can have, because malaria will cause diarrhea and vomiting, so you can be dehydrated, get into shock, complications.
Manje dokotela, ungaxwayisa uthini uthi is preventable and hlala sisho ukuthi prevention is better than cure. Umuntu ozohamba awuvakasha especially kulawo mazwe okwaziwa khona ukuthi kugcwele imalaria, yiziphi izinto afanele azenze before ahambe?
For South Africa, our neighbors, like Mozambique, it's one of the malaria endemic countries. Both Zimbabwe is one of the malaria endemic countries. Even certain parts of the country, parts where there is areas that are endemic, parts of KZN, parts of Mpumalanga around the Kruger area, and parts of Mpumalanga as well. So you don't even have to leave the country.
Yeah.
You must just assess the risks. Now, one of the Vagasha, maybe it's or Gunama cases where outbreaks, if you must do a little bit of research. But see, prevent malaria. I would say chemoprophylaxis. Kukhona drugs, pills, besiniketa wona la khona kuvikela malaria. So sibuyele ekutheni planning kubalulekile njengoba ngisho ukuthi mina I feel kukhona part of responsibility. My responsibility angisho sitoyi promote ngokuthi sende abantu babe aware. Hence kubaluleka kwale show lesikiyo manje. My prophylaxis we malaria ngicela highlight nje is my experience as a doctor. I've had patients labafika bathi bantu bafuna shortcut. Umuntu ufika sekahamba kusasa. Sekaphethe into la umngani wakhe colleague la ithole emsebenzini. Dokotela mina naku ngicela ubhalele bantwana banikete kona. Lokho kufanele bakunderstand but kula maphilisi ma chemoprophylaxis not everything is suitable for everyone.
Yeah.
So kubalulekile to plan consultation at least 6 to 8 weeks before. 6 to 8 weeks before you travel to assess what prophylaxis must you take. My prophylaxis with malaria la khona ayi-3 I've had bantu bathi hayi mina bangijova ngicela umuntu ngomjova. There is no injection. There is no quick fix. There's 3 types of prophylaxis. Kukhona imefloquine or imefilium, which is one of the drugs, the malaria. Imefilium Currently, at the moment, it's controlled. Iseko easily available like it used to be. It used to be a very easy drug to take because tata at least 2 weeks before travel. I not say once a week. I not say every week. Malaria, we not for 4 weeks after. Unfortunately, in the past few years, we've all struggled as GPs to get mephelium. It is still the prophylaxis of choice for pregnant women. So if you are pregnant and traveling, mephelium is the drug of choice. And then you also have Imalanil. Imalanil is one of the drugs that are prophylaxis for malaria. It's easy to take. It's the one I think commonly used because it's 2 days before. So Imalanil, you can take it 1 or 2 days before you travel. You take it once a day. Then you take it every day, malaria, and you continue to take it for 7 days after. And then basically the other one is doxycycline. Doxycycline, commonly it's an antibiotic, but it's used also as a prophylaxis for malaria. Doxy, if you take it a day or 2 before you travel, then you take it every day. But you're not if you take 4 weeks. For 4 weeks, for 4 weeks, and it's a daily dose. And then, but the side effects with doxy. But we call them patients where doxycycline, it is the drug of choice for prophylaxis. For example, patients laba immunosuppressor, some ARVs. Some of the ARVs, they interact with the Imalanil, so they have to be on doxycycline as the prophylaxis of choice. So it's not a one magic wonder. Importance of planning, and this is so important. That's the complications of malaria. It's important to plan. It's important to take medication because prophylaxis is from developing malaria than in a malaria endemic area.
Sikhuluma ngabantu base Mozambique bahlala ku area enemalaria. Bona basabafaka kanjani? Ngabe nabahlala baphuza nama prophylaxis every day or bahlala kanjani bona bangabi infected?
For bantu base Mozambique, kukhona concept ye herd immunity. Herd immunity gibo bayithola ngokuthi because infection ihlezi khona. So if you go out nabantu base Mozambique, they tell you ukuthi or nabantu basezini, they tell you ukuthi malaria ifana ne-flu the way igcwele ngakhona. So majority of the people there, it's not even a vaccine, they don't have to be vaccinated, but sebayithole enough for them to have immunity. So now uhlala khona une-immunity, hence ngoba abantu abaningi bane-immunity ayibaphathi. Nomuntu onganayo immunity uyavikeleka from the herd immunity because a certain percentage of the population has developed immunity. But immunity yakhona ayilast. Isikhathi lesidze, meaning if utophuma kuleyo country ungasahlali isikhathi lesidze, siba nabo laba, mina njengami ngisebenza eSekunda, ngihlala eSekunda ngisebenza khona, which is a migrant town. So if abantu abahlala eSekunda base Mozambique, they take it for granted, and we always treat malaria whenever they come back home. Because they go home and they don't take prophylaxis. Some of them, I cannot say all, but they go home, they don't take prophylaxis. And it's so classical. Now we're back to waiting between malaria. And they could have prevented it.
So kusho ukuthi ingakubamba kanye kokuqala iphinde ikubambe futhi kwesi2 kwe3
ibambe futhi especially also lose the immunity ngiyakubamba. Now mahlali khona ke vele ayi usenkingeni. It means every time you go there, you must take prophylaxis.
Ngithembe umlaleli lapha ekhaya ufunde kabanzi namhlanje ngesifo semalaria. Dokotela, njengodokotela osebenza ngabantu abavakashayo noma abavakashele eSouth Africa noma abaphumayo bovakasha, yiziphi ezinye izinto umuntu ofanele azenze ukuze mhlambe azivikele for imalaria lesi?
Yes, ngoba
ngaphandle kokuthatha amaphilisi.
Yes, doctor, that's a very important one. Malaria, nasibuka kuhandlisha malaria or awareness ngemalaria. Sicala ngokuthi kokuqala before sinje kahle kahle sijabulisa ku stage 2 uma ngechemoprophylaxis. Stage 1 is to avoid bites.
Also avoid kanjani mosquito ngoba mosquito adlala khona
to avoid malaria. it caused by night biting mosquito compared to travel medicine as yellow fever and the other ones that bite you during the day. So you must avoid mosquito bites at night. How do you avoid it? Now traveler. So kuhambe ke Mozambique is not just to tola chemoprophylaxis. We also recommend that you have nama repellents like final apply. Okay. Now let try and get long sleeve things. Ukuthi unga expose your limbs, get a net. Kukhona ama nets that are treated with this disinfectants, like with the repellent types, I think it's DEET. You get those nets that you use now, you apply my repellents, you can carry your mosquito coils, but do everything at all costs to avoid uba bitten by mosquito before sitokhuluma prophylaxis. Because if you do avoid uba bitten, then you're reducing your chances. But if mosquito gluma, at least until prophylaxis. Then if mosquito glumilo until prophylaxis, when the prophylaxis does not guarantee 100% protection at the end of the day, then hence konke your responsibility. One of my responsibilities umlali umbukeli ukuthi anganani. Nase iglumile mosquito unathile amaphilisi. The first thing now you develop ama symptoms, you present yourself. Coming back to the issue of prevention, docs, it's a first, actions to take to avoid the gloomy mosquito at all costs, and then secondly, taking prophylaxis low when you depart, and then lastly, now develop symptoms which munda shesha present, present patients should be informed. Absolutely, Mozambique automatically must go to the clinic. You seek help if symptoms develop. Yeah. We believe in the chemoprophylaxis. We also believe in the actions that you have taken to prevent the bite. I guess especially mild symptoms and severe symptoms. So kuna chances if you develop severe symptoms. Yes. It depends. It depends. Mild symptoms, obviously malaria is caused by a parasite. You must get malaria treatment. Supportive therapy is not going to help you. As long as you get the proper meds, you're going to be fine. But if you go to 20 treatments late, then there will be complications, of course. Like cerebral malaria, it has a very high mortality rate. Yes. But local definitely treatable. Okay. Definitely treatable. It depends. Treatment of malaria, it's so simple. It's a 3-day course, you won't believe. Usually the drug of choice is Coartem. We give the medication over a period of 3 days, and then you are set to go. If you are severe, you are vomiting, obviously we prefer to give you IV. Quinine is one of the drugs that is given IV. That sibonga kakhulu Dr. Dlamini. Ungathanda ukuthini kubantu namhlanje uhlele ekhaya. Ungadecide ukuthi kusasa ufuna ukuvakasha mhlawumbe ku Mozambique or wherever. Ungathini nje? Umuntu lofuna ukuvakasha lokubalekile kuplan itrip yakhe. Ngoba na uplan itrip njengase South Africa, we have the South African Society of Travel Medicine. It is a source that you can go internet, guide and ufuna certain countries. Even not only SASTEM, you can go to CDC, check in terms of my disease profile, and then you can go to a travel clinic or a medical service provider, the doc advisor in terms of vaccines that you must take, prophylaxis that you must take. Besides in the malaria, one of the common diseases, but it was not infections per se, like a recognized infection, but it's a concept. Travelers diarrhea, which is a common condition that affects our travelers. So it's in plan your travel because you don't want to take things with as much as you malaria, have mastered doses there and there, medication from developing travel diarrhea, take medication from developing malaria, carry your nets. You are prepared, but you must plan your travel at least 6 to 8 weeks before.
Okay. Dokotela njengoba sikutshontsha nje phela siyaqala ukuba nayo udokotela osebenza ngabantu abahambayo noma abavakashela amanye ama-countries. Ukhona lento abayibiza ngokuthi motion sickness. Ungabe nje usichazele kancane before sivala.
Oh yes, motion sickness is actually one interesting sickness. It's common kakhulu. Sometimes I'll think to travel ngiyibona abantwana uhamba naye emotweni singafuna kuhlanda sekafila dizzy yabona. Yendakala if ukuthi into loyibonako lento loyifilayo ayijeli kahle. So ungazi ukuthi you're losing a sense of your stability. Ngayibeka kanjani kufana nokuthi lo munye umuntu lone motion sickness uba nayo nakagibela esikepeni, lo munye uba nayo nakayogibela eplaneini, kakhulu ithanza abantu abagibela esikepe, but you also have it kumuntu lokugibela emotweni nakushisa kwanza ukuthi sakhala ngesisu sakafuna kuhlala. So it's preventable. It's not a big condition, but the condition lengamosha ilona yakho. You find yourself so masakwati kwenda participate kuma itineraries bawabekile for your visit sekufana uhlalulele kufana uhlale hotel. We say kubalekile to get enough air. If ukuthi uya travel eplane uhlushwa motion sickness ungahlali lapho kuhlalela eduze nabo cabin crew.
Okay.
Hlalela eduze nase lapho kutothola kala umoya khona kalula. If usemotweni ngamanye uhlale ku front seat and uhlale emuva. If useplane if usesikepeni ngamanye uhlale ku upper deck and uhlale kulona ku basement or the terminologies. And then uzame thola moya, you can get maphilisi la setawo motion sickness. You can stay hydrated. Lokunye nekudla lokudla kuyacontribute. If you travel and you have to hlushwa motion sickness, avoid ukudla lokunemafutha, avoid ukudla lokukhozela abo heartburn, like light snack and things like that.
Asibonge kakhulu dokotela. Sithemba ukuthi uzophinda usivakashele la kuzempilo zomontakalo. Bayabukela emakhaya. Yingakho lokho beseniphathele khona namhlanje. Kanti ke ngiyathemba ukuthi nifunde kakhulu namhlanje. Nisale kahle siphinde sibonane futhi next week Saturday ngaso sona lesikhathi 9 o'clock.